We definitely learned that the issue is still being looked into by Department of Health and also by the Attorney General's office. It is a complicated issue. We want to, as a committee, we really want to know if we are lacking in any legislation that will give either the Health Department and or the Attorney General's office more authority to be able to perform their functions in proceeding through this. It's such a highly contentious subject back in the districts with the thoughts of possibly, half of your healthcare system no longer being available to you. And legislatively, it is extremely frustrating that we aren't able to find a very easy and quick fix to this. But we are determined to continue to move forward to try and come up with a way to bring these two parties together so that we as individuals and as citizens still have that availability of health care that we've always enjoyed. We're up against a wall, so to speak, with UPMC's flat-out refusal to discuss any type of contract negotiations as long as Highmark is going to proceed to purchase the West Penn system. And we really want to know if, number one, if they are really and truly following their nonprofit status, which really requires them to have a public community mission. And obviously, some of us feel that mission is somewhat jeopardized when you are cutting out half of the public or more from using your facilities. Where is your charitable aspect here? Where is your public commitment here? And that's one of the things that the Attorney General is looking at. And as far as the Health Department, they are charged with our health and making sure that we have a delivery system out there that is a viable delivery system for all of us. And again, we really need to make sure that these departments have the tools in place, and we're looking for any guidance they might be able to give us as we move forward to try and get this to an agreement. The deadlines are coming quick. There's no doubt about it. It's going to affect the Pittsburgh area a little bit quicker than it is going to affect the Erie area when it comes to deadlines. The contract is going to expire, and in Erie, Hammett Medical Center's contract has a 1-year further extension than the rest of the system. So contractually, we have a little bit more time for those of us in the Erie area. But however, we still don't know how that's going to affect the physicians in this network. If it's going to end with those here, next July, I believe, when the contract expires. So, it's either going to all end in July, except for Hammett Hospital, which will be another year.